Okay, it's Dr. Buford. We're just getting started on the right shoulder. We're looking in from the back to the front. Everything's magnified, hold the camera, 30 or 40 times on the screen. And we've already identified this area where the biceps anchor is torn. This is the edge right here. And we've already actually released a little bit of the cartilage. Rotate me down to 6 o'clock. Other way. Okay, so we can see we've exposed the bone here, taken off some of the cartilage where we're going to be reattaching this. Okay, and so now, before we do that, we're going to look around the rest of the joint. This is the posterior shoulder. Not too bad, looks pretty good. You get a little bit of, hold the camera here. Okay, so as we look down the front of the shoulder, you've got a little bit of some wear and tear changes on the glenoid. You can see at the tip there of the cannula, but the anterior structures look pretty good. We're going to look back up at the rotator cuff. That's the other reason we're here. And so far, so good. I don't see any significant tearing on this side. We're going to go ahead and take a punch and make a starter hole in the bone for our double-loaded anchor. And sometimes we use a drill bit. We'll just decide how we're going to do that here. Okay, so we've got a double-loaded anchor in. We're going to take 3 of the sutures out of the way here, just like that. Okay, and so now those 3 sutures are out of the way. And now we're going to take the one suture that we'd like to work with first. So it's inside. We'll take a grasper and a suture hook. You got to keep pressure on it so it doesn't back up. Okay. We'd like to come out somewhere right about there. And I like that shot right there. So we'll go off on the video. Okay, so we've got the biceps anchor repaired. You can see our 2 sutures. It also reconstructs that middle glenohumeral ligament, which you can see there. And now we're going to get to work on the rotator cuff if we need to. We're going to have a look from the other side. Okay, so we're up in the subacromial space. We've already done a little bit of a, let me see this real quick. Hold it right about there. A little bit of a decompression. We're looking now at the rotator cuff to see if there's any remaining calcium. You can see we can make some little channels and some needling in the tendon. And so far it looks pretty good. So we'll rotate the shoulder a little bit. We see some areas of inflammation. But I'm not seeing any significant calcium come out right now. This is all the way over the anterolateral edge. We can evaluate that. That looks good. And that's the footprint there. Okay. So I think we're going to finish up here. I'm going to keep looking around. I don't see anything else at this point that we have to do, which is good news. If there's anything else that we do surgical, I'll come back up on the video, but otherwise I think we're just about done. Good luck to you now. Bye-bye.